Welcome to Season 2 of Unprivate Parts. This podcast is a space where women can feel supported and understood as we have open, honest conversations about women's health and the uncomfortable subjects we all want answers to. In this season, we will explore the complex realities of breast and gynecologic cancer journeys, breaking them down with empathy and expertise. From hearing the words, "you have cancer," to making decisions, undergoing treatments, navigating survivorship, and seeking support, we will cover it all. Nothing is off limits, and no topic is too uncomfortable to discuss here. This is Unprivate Parts.
Hi, I'm Lauren Smith, the Manager of Business Development here at Women's Hospital and the host of the Unprivate Parts podcast. Food is something we usually take for granted, but during cancer treatment, it can become one of the biggest challenges patients face. Nausea, taste changes, mouth sores, and loss of appetite can make eating feel overwhelming, even when your body needs nourishment the most. In today's episode, we're joined by Robin Strate, our clinical oncology dietitian here at Women's, to discuss how nutrition supports your strength, your immune system, and your recovery, even when food feels like the last thing you want. We'll talk about why eating becomes difficult, how treatment affects the body, and what practical, realistic nutrition can look like for women facing breast and GYN cancers. Robin, thank you for coming today. Please just right out the gate, tell us what a clinical oncology dietitian does.
A clinical oncology dietitian helps patients to manage their symptoms throughout treatment so they can get through their treatment. We talk a lot about prevention of recurrence. We talk a lot about nutrition during their treatment to help them feel their best and get through those treatments. And of course, we talk a lot about nutrition going forward into their survivorship.
Awesome. Can you explain why good nutrition is so crucial for women with breast and GYN cancers?
Yeah, I mean, there's many reasons why, it's important. One, keeping them strong and healthy throughout treatment so that there's minimal, changes in dosing or minimal delays. But then also just going forward, a lot of these women are on medications that sometimes can affect bone health. So we want to make sure that they're preserving lean mass and also bone density after treatment as well.
Do you find once a patient is diagnosed, I'm just putting myself in someone's shoes, do you have to change everything? Are you becoming hyper aware of everything you're putting in your body?
You definitely do not have to change everything. And yes, they become very hyper aware. I think, a lot of times people get a cancer diagnosis and well-meaning family, Google things and search things. And
Oh,
so
yeah.
they come in with all of these questions that either they themselves had or their families telling them, you can't do this or you should do this. And so there's a lot of fear around nutrition when a person is first diagnosed. Not only are they fearful, of the things that they're eating going forward, but then they also a lot of times have guilt and blame, thinking that maybe what they did is what caused their cancer. And so I'm there to kind of help them
Yeah.
manage those feelings too.
Like I hear people say, oh, the artificial sweeteners, coffee, are these just myths out there? Are there any truth to helping
Most
prevent?
most of them are definitely myths. Coffee actually can help reduce cancer risk.
Oh,
So
amen.
yeah,
Okay.
I think a lot of people have a lot of misinformation, and unfortunately there's a lot of disinformation out there as well. So yeah, I'm definitely there to help them, work through what is truth, maybe what was a fragment of truth that someone ran with in the wrong direction sometimes, so that they can kind of put those fears to bed and really, continue to eat a healthful diet that's also joyful.
Oh, I love that. A joyful diet. And what is a joyful diet? You don't normally put those two together, but what does a joyful diet consist of?
I think a lot of times people forget that diet and just our lifestyle is something that not only helps to nourish the body, but also connects us to our culture and our family. And so a lot of times people will get a little too far down the rabbit hole with their nutrition to the point that it causes them anxiety, when they go places and they can't do things socially or enjoy time with family and friends. And so sometimes I'm kind of helping them dial it back a little so that we can still enjoy those fun foods while looking at the big picture.
Let's talk about some of the symptoms and why does nausea become so persistent for many women? And what are some strategies to keep nausea at bay so they can actually eat?
Yeah, nausea can happen for several reasons. I mean, a lot of these chemotherapies are targeting cells in the body, not only bad cells like cancer cells, but good cells too. And so a lot of times, nausea is one of the main side effects that people experience. They can also have a lot of nausea associated with fear or anxiety from treatment too. So there's different treatments for the different types of nausea. The doctors and the nurses are better at knowing which medications will help to treat those different symptoms. But as far as nutrition goes, we can definitely help them to manage those symptoms and make sure that they're continuing to eat as balanced and healthful of a diet as possible.
And this might sound silly, but when you're nauseous and you don't want to eat, is it better to force yourself to eat?
Absolutely. I don't know if I would use the word force, but yes, I do definitely tell my patients the nausea that's associated with treatment oftentimes is different than the nausea associated when we have a virus. If we have a virus, a lot of times we eat something and it's coming right back up. But this nausea that's associated with treatment, a lot of times is it's very similar to a pregnancy nausea where you're hungry and you're nauseous at the same time, and then you're just confused and you eat and it does make it feel better, and you're like, what? That's so weird. So we definitely encourage certain foods over others, things that are a little milder, maybe aren't really greasy, fried, things that would give you reflux or worsen your nausea. But we definitely encourage small, frequent meals of those lighter foods throughout the day.
And in terms of struggling with the weight loss and malnutrition, that can become a real risk during treatment. What signs should patients and caregivers watch for that suggest a woman might be becoming malnourished?
Absolutely. Yeah. The statistics are that approximately 10% of breast cancer patients and about 29% of GYN patients will actually be at risk for malnutrition prior to their diagnosis. So, one thing that they can look for with that is a decrease in appetite and a decrease in their actual intake associated with that decreased appetite, and then any weight loss that they've had at all. That's two questions that are part of a malnutrition risk screening tool that we actually use when patients are diagnosed, to try to catch those, in the beginning, so that we can, make sure that we're continuing to eat well throughout treatment. And then, of course, during treatment, we are doing that screening every time they're coming in for infusions, and they're asking similar questions in the radiation offices as well.
Tell me a little bit about mouth sores and dry mouth. I hear those are common with chemotherapy. What dietary adjustments or textures make food easier to tolerate when your mouth is sore?
Yeah, mouth sores definitely are something that can be associated with treatment. Dry mouth as well. Dry mouth sometimes can occur because of dehydration as well as just dryness from that's caused by the medications. But both of those can be quite frequent during treatment. So we do have a little baking soda salt mouth rinse recipe that we give to all of our patients. I know if you've ever gone through treatment, I'm sure you've heard this many times. But it's equal parts of baking soda and salt with water, and they mix that and use that as a prevention. But then it's also great to be used throughout their treatment, even if they, don't or do have sores. It'll help keep the mouth clean, soothed, get out little food bits that might be staying on the mucosa, that could potentially cause irritation. And then as far as foods, anything that's soft, cool, room temperature, those are things that are typically tolerated a little better. If you have a mouth sore, eating Captain Crunch is not going to help at all. And so we definitely try to talk to them about those softer foods, things that are cooler, room temperature. Again, those things, typically won't cause you a lot of irritation. Sometimes, we tell them avoid spice, avoid things that are really acidic. Sometimes things won't necessarily cause a sore, but if there is irritation, it's going to let you know.
What happens when water is unappealing? What creative approaches do you recommend to help women stay hydrated?
Yeah, that's a tough one. I think a lot of times people think water is the only thing they can hydrate with. And so I like to remind them that if it's in its liquid state at room temperature, it counts towards your hydration. Obviously, we encourage them not to drink a lot of sodas and things like that, but I try to, encourage them to vary their hydration sources. So they may choose half of, their 8 to 10 cups a day to come from water, and the other half could come from a glass of milk, a glass of juice, maybe a cup of broth or some soup, or even something like yogurt or lots of fruit in the diet. All those things can help to hydrate them.
And what about like blending fruit or some things together, that counts?
Absolutely. Smoothies are great. We encourage those all the time, especially when the appetite's not great. Sipping on a smoothie throughout the day will help to get extra nutrition while also giving you some fruits and vegetables.
And then, opposite of blending, when the eating feels like a chore, what are realistic, nutrient dense options that women can grab with minimal effort on those tough days?
Absolutely. Yeah. We talk a lot about how there's fatigue during treatment. And so I always tell them to keep easy things on hand, especially things that are protein rich and, like you said, nutrient dense. So things like string cheese, Greek yogurt, hard boiled eggs, trail mixes, granola. I tell them keep a rotisserie chicken and some steamed fresh bags of vegetables. Those are all quick, easy things that require minimal effort. A lot of times they think, oh, I'm fatigued, but I have enough energy to cook. Yeah, but do you have enough energy to clean up after too? If you don't have family support at home, having those easy, um, you know, hands off ideas is always helpful.
Registered dietitians play a crucial role in cancer care. At what point should a patient be referred to you, and what can that support look like during their treatment?
It would be great if we had enough dietitians to see every single cancer patient. I think, nutrition is so crucial and having that education would be great. But definitely, a referral for a patient that has any changes in their intake or even bowel changes, those are all things that can be managed with the help of a dietitian.
And we're just going to go there. The bowel changes, is that more common not being able to go, or either way?
I would say it's definitely either way. We get a good share of both of those, constipation and diarrhea. Diarrhea is actually very frequent, while going through cancer treatments. And then, of course, you have certain types of cancers, especially GYN cancers, that can cause a lot of changes in strictures and scar tissue and other things that can occur within the in the bowels, and that can cause things like obstructions. So there's risk of both ways of constipation and diarrhea. It's not too common to have someone who has no bowel changes.
And you were talking about protein rich go to grabs. Protein is often emphasized for people undergoing treatment, but can you explain further the role of protein for muscle strength, healing, and how women can get enough on their low appetite days?
Yeah, protein is definitely crucial for maintaining lean mass, especially as we're going through treatment. If we have changes in our intake, sometimes weight loss does occur, and we want to make sure that we're preserving that lean muscle as best we can. Exercise can help to do that, but unfortunately, sometimes during treatment, there are certain restrictions for exercise, especially with that resistance training. And so, protein is definitely going to be important for that. It's not hard to get protein in a regular diet, but definitely when you're not feeling well or you're having taste changes that possibly make meats taste metallic or just have an off flavor, it can be difficult. And so sometimes we encourage patients to rely on non meat protein options that maybe have less of an off taste. So things like dairy, yogurt, cheese, beans, um, nuts, seeds, nut butters. These are all great protein sources as well.
Dairy can be a great source of protein. How can patients decide whether to include dairy, and are there good alternatives if dairy causes discomfort, like you were talking about with bowel changes?
Yeah, absolutely. So a lot of times we will caution patients if they've had diarrhea for more than 3 days. Sometimes that can affect how the body is able to break down that lactose, which is in a lot of your dairy products. And so we will oftentimes recommend a non-dairy option or to do a lactose free or to use a lactate enzyme when they consume that dairy. Most people aren't going to have too many issues with it, but if they do, soy milk is a great alternative. It's nutritionally the most equivalent to cow's milk of all the different plant-based milks, as far as protein content, and then most of them are going to be fortified with calcium and vitamin D.
I hear everybody talking about oat milk. Get the oat milk. Okay, it's a no go. I don't even know what oat milk is. Is
It's
that
a no-go. It's a no-go for me. I mean, if you have someone maybe who's allergic to soy or who's allergic to almonds, oat milk is a great alternative. But as far as protein, it minimal, maybe 1 or 2 grams of protein, whereas a cup of soy milk is going to have 8 or 9.
I love learning something new every time. Avoid the oat milk. Let's talk about carbs. They often get a bad reputation, but we know they're vital for energy. How should women think about carbohydrates during treatment? And please tell us what kind of carbs are most helpful.
Yeah, carbs are great. I love carbs.
Me
Carbs are what
too.
I feed to my children before they've got to do swim meets and things like that. They're definitely crucial for many things. One, brain function. They're what give us energy. Carbs are our body's actual cleanest burning fuel source. It's what our cells prefer. And so we need those carbohydrates to get us through workouts, to get us through our day without having fatigue. Carbohydrates are also the only place where you get fiber in the diet. We know that 90% of Americans are not reaching their fiber goals. So carbohydrates are definitely a main and an only source of that. So we do want to choose. Sometimes you'll hear complex carbohydrates or whole grain as a source of carbohydrate. But carbohydrates do come from dairy. They come from fruit. They come from your grains, your beans. So there's lots of sources of carbohydrate in the diet. But your high fiber carbohydrates are going to be what are more beneficial to you. So beans, fruit, your whole grains, those are your best sources.
90%?
90% of Americans do not reach their fiber goals.
Wow. What's the cereal? Fiber One.
Yeah, fiber one is great. Quinoa, beans, lentils, any whole grain pastas, even things like breads get a bad rap, but if you're choosing a whole grain one, it's definitely still part of a healthy diet.
Okay, there you have it. We can eat bread. And after active treatment ends, nutrition goals often shift, I'm told. What's important to focus on in the months after, especially for strength rebuilding, preventing reoccurrence, and managing weight?
Absolutely. That's a great question. Oftentimes people come in and they think they want to make those changes right away. And so I always encourage patients to, embrace a healthy diet while you're going through treatment. However, there's times where you may wax and wane between what's a general healthful diet and what's more therapeutic to help get you through treatment. And then we really focus on, getting that survivorship diet in line once we're finishing up treatment. And so we oftentimes talk about different types of dietary patterns, things like Mediterranean diet or dietary guidelines for Americans. The American Institute for Cancer Research's New American Plate. These are all different dietary guidelines that patients can follow that are all scientific evidence based. What they all have in common is that they are rich in fruits, vegetables, lean protein, low fat dairy, whole grains, not eliminating any specific food groups, making sure that we're having a lot of balance.
And what did you say? New American Plate? That's a resource?
Yeah, the American Institute for Cancer Research, they have their dietary pattern called the New American Plate, which recommends 2/3 of your plate be from things like fruits, vegetables, and plant foods, and 1/3 or less of your plate be from animal proteins. It's a great dietary pattern to follow. They have a website with lots of resources as well.
And beyond combating side effects, is there any evidence that nutrition influences those long term outcomes like reoccurrence?
There is some evidence. I mean, we do know that diet obviously plays a huge role in the entire, cancer continuum, all the way from, you know, helping to, prevent DNA damage, repairing damaged cells, even killing off cancerous cells. So we have a lot of evidence to say that nutrition is beneficial. But there's even some evidence to say that soy consumed within the first year after a diagnosis can decrease the risk of recurrence for certain types of breast cancer. So I think that overall balanced diet, where we're including all of those food groups, making sure we're getting fruits, vegetables, lots of phytochemicals from those plant foods, all is going to help protect you in the long run.
There's so much information out there, and now people are doing their own research. Thank you, Internet. But what are some of the myths you hear, common misconceptions that lead to cancer, like artificial sweeteners, Diet Coke, like I said earlier, coffee? What are some of the biggest myths
Yeah,
out
I mean,
there?
biggest myth. I would say the number one thing people come in with is, I can't have sugar. Sugar feeds cancer. And so that's one of the big ones that we definitely talk about with almost every patient because of that. So the short answer is no, and the long answer is about 11 typed pages. And so we try to give them the cliff notes of it. But, we do know that, every carbohydrate that you eat eventually is going to break down into glucose. And again, that's your body's cleanest burning fuel source. And so it is important, though, that we try to get that from whole grains and things that are providing us with fiber and phytochemicals and other nutrients. But we do want to reduce our intake of overall added sugars in the diet. And so one way we can do that is actually with artificial sweeteners, and they do not increase cancer risk. The it's called the GRAS list, but generally regarded as safe. Typically, there's a threshold for what is considered safe when they've done studies with those with the different products that are on that list, and the threshold of 10% of where you would have adverse events would be consuming something like 19 Diet Cokes in a day. And so I shouldn't say nobody, but most people are not consuming that level of artificial sweeteners. And so if you have a patient that's maybe insulin resistant or diabetic and they still want to enjoy maybe something that's sweet in their life, obviously we encourage things like fruits and other non added sugar type things that are sweet. But to say that they should never enjoy a Diet Coke is silly. It can definitely still be part of a healthful diet. It's not something we want to do in excess, but it's definitely better than consuming copious amounts of added sugar.
You said the GRAS list? That includes, tell me what that is again?
It's generally regarded as safe list.
Oh.
It's a list by the government of different additives or food things that we use within the food science spectrum that are generally regarded as safe, meaning they're safe for human consumption.
I go down and look at these lists that, what are the best things to eat to prevent? And fennel was always on the top of the list. Is that a thing?
Fennel's a plant food, so I would say sure it's a thing.
It has phytochemicals.
Yeah, it has phytochemicals. So yeah, there's something that's in plants that are called phytochemicals. You can only get it from plants. It's what give plants their color, odor, smell. So when we're going to the grocery store, I always tell patients look for one thing from each color of the rainbow to put in your basket that week, and maybe try one thing that you haven't had in a while, and that ensures that you're getting a good variety of those phytochemicals. Phytochemicals definitely play a role, like I said, within the entire cancer continuum. And so they're a very important part of the diet. We don't have established levels for what we should consume of them like we do with vitamins and minerals and other nutrients, but we do know that they're important.
Do you give your patients a tailored grocery list, or is that a one-on-one consultation depending on how much, let's say, protein they need, or just, you said the colors of the rainbow in the grocery.
Yeah.
What does that look like? Telling them what to shop for.
Yeah. So, a tailored list is probably something that would happen more so if you were having a one-on-one consultation with me. But definitely, we have different little handouts and other things that we can provide to patients, showing them some of those more whole, less processed foods that they can get from the grocery store. A list of all of the different dairy or all of the different fruits and vegetables, lists of what is considered a lean, unprocessed meat, that sort of thing.
So when patients come to you and the big talk about organic vegetables, are there any pesticides or carcinogenics that we need to stay away from on these vegetables that we're shopping for?
Typically, what I tell patients is, when you go to the grocery store, you should shop seasonally and what's in your budget. If it's $14 for organic strawberries and you leave the grocery store with no strawberries, you've done yourself a disservice. The USDA tests residues on conventionally grown produce. And so none of these levels are anything that would pose a risk to human health. Um, we still use pesticides and herbicides in the organic farming. They're just ones that are not synthetic or created in a lab. And the beauty of having something that is synthetic is that it is organism specific. So if you have a certain bug that affects a certain type of produce, you can spray a pesticide in smaller amounts that's going to kill that one particular organism, versus something that's organic. It might not be as effective, and so you're spraying it with more of these organic pesticides that can still be very toxic for human health. And there is no one checking residue on organic produce. So
Really?
I would say buy what's in season and make sure that you're washing your fruits and vegetables off with clean running water for at least 30 seconds, and eat an overall healthful diet.
There's immense pressure to eat right for women, but the reality can feel messy, discouraging. What message would you share with women who feel guilty or frustrated about eating during treatment?
Give yourself grace. You are doing the best that you can with the resources that you have and the season of life that you're in. A lot of our patients are busy moms who have kids who still have to have a stable family life at home, and if you are eating sandwiches in the car trying to get kids to and from practice, you're still doing a good job.
We talked about diet during treatment and after treatment. Tell me a little bit more about preventative and the lead up, maybe what we should be eating or staying away from.
So a lot of times, treatment doesn't happen right away after a diagnosis. And so there is a little bit of lag time there when patients could definitely be doing their best to consume a nutritious diet, before they're going to have a lot of those side effects that may be associated with chemotherapy or radiation. Um, your GYN patients oftentimes are having surgeries. A lot of your breast patients maybe aren't having surgery right away, but there's aspects of adequate protein for healing if you have had surgery. And again, just boosting up all of those good nutrients, prior to when those side effects are going to start. So again, just a general healthful diet, fruits, vegetables, lean protein, low fat dairy, whole grains, and making sure we are getting enough protein.
Thank you, Robin, for joining us to discuss the importance of nutrition during and after cancer treatment. It isn't about perfection, it's about doing what you can, when you can, while giving yourself some grace. Whether that means a protein shake, a few bites of soup or broth, or just staying hydrated, every small effort matters. Your body is working incredibly hard, and nourishing it is an important way to support your healing. Remember, you don't have to navigate this alone. Your care team and nutritionists are here to help you every step of the way.
Thanks for joining us for this episode of Unprivate Parts. Don't forget to subscribe to our podcast so you never miss an episode. For more women's health tips and cancer-related content, follow Women's Hospital on Facebook and Instagram. If something you heard resonated with you, please share it with others. Thank you for listening.